This is Dr. Atta from DestroySocialAnxiety.com, and I wanted to talk about the practical application in a real-life situation and of exposure therapy. And I wanted to talk about a few concepts here. So the example I wanted to talk about is fear of flying. So this is a common problem for a lot of people. Personally, I have experienced it myself. It has some biological background, in my opinion, because we obviously don't have wings, and it's unnatural for a human to be on high altitude, and generally it induces fear. In specific situations such as airplane, that is amplified by the fact that we are in an enclosed space and we have no way to predict what's going to happen. We are not in control, and generally it's a fear-inducing situation. So how do we solve that problem? Because if we look at the logical premise of the situation, it is objectively not dangerous to fly a passenger plane. In fact, if you look logically at the situation, it is much more dangerous to ride in a car or drive a car. My belief is, I think it's 10 times as dangerous to drive a car than to fly a passenger plane. And yet, we are not afraid of driving cars. At least most of us are not afraid of driving cars. We are much more commonly afraid of flying planes. And obviously, from the logical standpoint, this situation does not make any sense whatsoever. So how do we resolve this problem? Something that is objectively, logically not justifiable, and yet our emotions tell us that it is a dangerous situation. So obviously there are several solutions. There is a solution of, depending on the school of thought, trying to understand the cause of the issue, trying to see if this is biological cause can be addressed by medications. They are very helpful, the medications, especially in the short-term use. Benzodiazepines are very, very useful. I tend to like to use short-term acting benzodiazepines such as Ativan, up to maybe 2 milligrams or 3 milligrams per flight, let's say up to 4 hours, maybe up to 6 hours, and it's very useful. However, it's not a permanent solution. So the question is there such a thing as a permanent solution to this problem? And let me give you an example of the solution that I came up with, and to show you how it could work. Okay, not everybody can do it. It depends on the environment you are in. Obviously, the parameters we set up here are unique to, let's say, to the American environment, but I think some of the elements could be used everywhere. So let's say I'm afraid of flying a plane. So the first thing I need to do is to find a low threshold experience that is similar to flying a plane. And what would that be? I personally found out that the experience that I like the most, or it's closest to that experience, is going on a roller coaster. Okay, because roller coaster also has similar principles. You are in a kind of environment you cannot control. It goes up, it goes on a very high altitude, and then it goes down. In any case, it's a scary situation, and yet it's extremely safe to ride a roller coaster, and yet a lot of people are afraid of that. So what I do is I go on a roller coaster. I try to find a smallest possible roller coaster to begin with, if my fear is very excessive, and I go in the first roller coaster. After successful completion, I check how I feel, and if I'm satisfied, and most of the time I'm pretty satisfied with the outcome, I can repeat it. If by any chance I feel overwhelmed with the initial experience and I don't want to repeat it, what I suggest is going down a notch, if going down a notch is possible at all. Okay, so we start with the smallest roller coaster. If it's successful, but we are not 100% convinced that this is it, we can repeat it. the same experience. If we are overwhelmed, we go down a notch. Once we complete an experience of a roller coaster, we take it up a notch. We go on a little bit higher roller coaster, more difficult roller coaster. Again, we go to the same phases of discomfort initially, but this should be already a little bit lower level of discomfort than the first time. And what is important about the roller coaster experience is that there is a moment of making a decision about the experience. But once we decide, once we stand in this line and once we get into roller coaster, the moment we get strapped to a roller coaster, there's nothing we can do to get out. Okay? And even though the fear is overwhelming, especially in the beginning phase of the roller coaster going up, there's not much we can do to stop the process. That is very important, because if you really had a choice, you would stop the roller coaster and get out. So you need to put yourself in a situation in which that is not possible. And a roller coaster is generally that situation. You can't get out of it once it's going, unless this is a big emergency situation, but generally you cannot get out of this. So you go again. And typically after such experience, especially if you control the process, in other words, you make the decision about doing it, you do feel a small element of relief after you're done with it. Okay? There's some pride, there's some satisfaction. The next step is to get it up a notch and go to the higher roller coaster. Then do it again at the higher roller coaster, and do it again at the highest possible roller coaster, ideally, preferably on the same day. And you end up a day with the highest possible roller coaster. You have the sense of accomplishment, and you end for that day. What I suggest is the next day you repeat the process. However, you start higher. So you don't start with the lowest roller coaster unless you really have to and you feel like you need to do it. I would start with a middle difficulty roller coaster and end up the day again on the highest level roller coaster. In fact, what I would do is at the end of the highest level roller coaster, repeat the highest level of roller coaster experience again. Okay, so we got to the level of roller coaster. However, being in a roller coaster could be viewed as not as scary on some levels as flying a plane. Why is that? It's because, we rationalize the experience. We're saying, oh, we're just gonna fall from 100 feet or 50 feet or 20 feet. We can maybe grab something. We may make it. Okay, in a plane, once it crashes from thousands of feet down, there is no way of making it. So your brain is going to rationalize it as it's not the same thing. It's not exactly the same. Therefore, what I talk about is the concept of overshoot. And that is to make an experience that is similar to what you did, but is more challenging than flying a passenger airplane. And in this particular example, what is more difficult than flying a passenger plane? I found out, or obviously you don't need to have to be a genius to figure it out, that much more scary experience than flying a passenger plane is flying a small private plane, a small Cessna. So again, the idea is to create a similar situation. You go, if you can afford it, obviously, because it can be quite expensive. You go and you go for introductory lesson in a small passenger plane, but not the smallest, okay? And put yourself in a situation in which you cannot get out initially. So you decide you want to take control of it. You get into this small passenger plane. You fly. There is a moment of very big discomfort, especially in the beginning, that you don't feel that you're in control. However, the process happens, your body experiences, nothing is going on, you come down. You can repeat that process a few times, typically, until you're comfortable in that particular setup, and eventually you will get comfortable. Once that happens, I suggest getting into smaller plane, okay? You find smaller and smaller until you get the smallest possible plane. Typically, the smallest passenger planes are very, very scary because it feels, especially like I believe the smallest Cessna is 155 or something. it feels like it's about to fall, you know, into small little pieces while flying. It is indeed a scary experience for the first time. And yet your body gets used to this, and you are getting that experience over and over again, in which you realize that, you know, nothing is happening. You do that until you are comfortable. If you really want to take it up a notch, you can take it completely up to the next level. In the United States, they offer flights with where there is a professional pilot who does acrobatics, and this is totally insane experience. I personally haven't done it. I was close to getting it. I was busy to do it, which essentially the plane goes, you know, like a plane roller coaster, and that is very, very challenging experience. However, once you have all these experiences built up to that point, you're able to do it. And once you do that, essentially you have almost reprogrammed your body, your sensories, to the fact that it's not the end of the world, it's doable, and you are able to withstand that discomfort. Okay? And then once you're done, presumably it would be good to repeat that experience every now and then, you know, once every few months, once a year, depends on, obviously, on the person. You have stored that memory into your body that is no longer as uncomfortable as you thought about. And at that point, flying a passenger plane is no longer a serious challenge. And that is an example of how exposure therapy could be used in treating such simple things as fear of flying, which is a very common problem for a lot of people. So that will be it for this video. Thank you.